সবাইকে স্বাগত জানাচ্ছি মালয়েশিয়া হেলথ কেয়ার ট্রাভেল কাউন্সিল নিবেদিত আজকের এই বিশেষ টক শোতে। আজকে আমরা কথা বলবো মালয়েশিয়ার বিশেষায়িত হাসপাতালের বেশ কয়েকজন চিকিৎসকের সাথে। দর্শক চলুন তাদের সাথে পরিচিত হয়ে নিই। উই হ্যাভ এ গেস্ট ইন মাই লেফট সাইড, ডক্টর ইস্কান্দার মির্জা আমরান। হি ইজ দ্য কার্ডিওলজিস্ট অফ ইনস্টিটিউট অফ জান্তুং নেগারা। ডক্টর ইস্কান্দার, আপনাকে ওয়েলকাম টু আওয়ার শো।
Thank you very much.
Then we have a guest, Dr. Arnil George Sirimani. He is the oncologist of Prince Court Medical Center. Dr. Arnil, welcome to our show.
Thank you.
We have a guest in my right side, Dr. Ajemuddin Elias. He is the orthopedic surgeon, KPG Ampang Puteri Specialized Hospital, Malaysia. Dr. Ajemuddin, welcome to our show.
Thank you.
Okay. First of all, I want to know from Dr. Iskandar. You are the cardiologist and you are working now IJN. We have seen so many Bangladeshi patients suffering cardiovascular diseases. Yeah. If any Bangladeshi patient go to IJN, which types of support you will provide from your hospital?
Actually, there's a lot of support that we can help to accommodate for those Bangladeshi who have heart problems. The most important part is the support that we want. Actually, the centralized heart support, which is those with the cardiovascular disease, those who have heart attack, or any other heart diseases other than heart attacks, such as valve problem or muscle problem. This one we can support very well because we have the specialty there. And then the support not only based on the treatment, but also the procedure that we can do. So far, we have almost all the state-of-the-art of technology that we have in IJN, so that we have to make sure that the patient that came to IJN have a better outcome. First, we need to make sure the procedure is fast, and then we make sure the operator is a high-volume operator, so that the procedure, so there's no complication during the procedure. This is what support that we can actually give to the patient that came to our center.
If Bangladeshi patients want to contact with IJN, which procedure he or she will follow?
Actually, you can go through first with the MHTC. You can contact them and they will direct you towards IJN how to get appointment. And you can see previously from the previous interview that MHTC actually very helpful in helping the tourism how to make sure that they can have appointment to our center. And if there's another way that you want to have appointment in IJN, you can just go through our website. You can go through all the doctors, the consultant cardiologists, the cardiologists that you prefer. All the subspecialty will be there, stated there throughout the whole website. And from there, you can make appointment.
Thank you, Dr. Iskandar. Dr. Arnil, you are the oncologist from Prince Court Medical Center. So many Bangladeshi patients also suffering cancer. If anyone wants to go to your hospital, which types of service you will provide from the Bangladeshi patient?
In terms of, as a clinical oncologist, again, I deal with adult cancer patients. Okay. So what we are going to deal with is providing all sorts of necessary up-to-date treatment. So we have things like we have actually surgeons that can operate on any form of cancer, but subsequently when they come to me, basically I manage things using chemotherapy, immunotherapy, targeted therapy, and of course there's also radiation, which plays a very big important role in terms of cancer treatment. So this is all available in Prince Court.
Thank you, Dr. Arnil. Dr. Ajemuddin, you are the surgeon of orthopedic. So why Bangladeshi people or Bangladeshi patient will choose your hospital?
Okay, basically what KPJ Ampang Puteri can offer for people in Bangladesh is basically we have wide range of treatment in orthopedic problems. So for example, if you have arthritis of the knee or the hip, we have the facilities and surgeon that can do from conservative treatment to the surgical treatment, in which can do surgery from arthroplasty, joint replacement. In fact, in other for example, in cases, trauma cases, non-union of following injury. So we have these specialties that we can offer in terms of corrective of surgery, malunion, non-union. The wide range of treatment basically is up to date, and it's the most advanced in what I would say in the private center in Malaysia.
Thank you, Dr. Ajemuddin. Dr. Arnil, for cancer treatment, we need advanced technology. All types of technologies is available in your hospital?
we do have the necessary up-to-date treatment. Okay, so it also the treatment depends on the type of cancer, and it's very tailored. It's very personalized. So when I talk about chemotherapy, radiation, and all this, not everything is used for one specific cancer. But you need to be up to date. As an oncologist myself, I'm up to date with the necessary treatment, and we need to use those treatments tailored to any form of cancer. For example, breast cancer can be different from lung cancer, but yes, it is available.
Cancer can totally cured
Okay.
if it is properly treated.
Right. So, in general, cancer is divided from stage 1, 2, 3, 4. Of course, when you detect it early in stage 1, we are definitely curing your patients. Stage 2, stage 3, yes, we are trying to cure. Stage 4 is when it is a bit difficult. It's most of the time you can't cure, but with the latest treatments available, we try to give the best quality of life, reduce the side effects, as again treating the patients to best of their ability. So there is new treatments available. So talk to your doctor about it.
Thank you, Dr. Arnil. Dr. Iskandar, you are the cardiologist. In your hospital, advanced technology available also?
There's a lot of advances. We have a lot of subspecialty in IGN. One is electrophysiology. We have the most advanced state-of-the-art in ablation techniques. Some people are born all having this abnormal rhythm of the heart, like atrial fibrillation. We have a new technology we call pulse field ablation, which is the procedure can be done within 20 minutes. The traditional way actually can last up to 2 to 3 hours. Now we can make the procedure very short. And then we also are now going towards the minimally invasive surgery, cardiothoracic surgery. Previously, we do a median sternotomy incision, which is a very big operation. But now we can just do a very minimal invasive surgery for bypass, cardiac bypass. And not only that, we have the highest number of, now some patients are having this very narrowing of the valve of the heart. We can put a valve, a ring there to actually improve the function of the valve. Actually, we are one of the highest number in Southeast Asia doing that kind of procedure. So most of the subspecialty have their own technology, and we have it, most of the technology in the world, we have it in IJN. So far.
Thank you, Dr. Iskandar. Dr. Azimuddin, if any person fall any accident, so when he or she will go to Malaysia?
Okay, basically in acute cases, maybe the treatment still may be required here. Once this patient much more stable, can be transferred, or patient need further treatment. Usually after a few months, or still get a patient having any sort of complication, they can always travel to Malaysia to get the further treatment, the best treatment that we can offer in terms of trauma or fractures or this thing.
Okay, Dr. Azimuddin, thank you. Dr. Arnil, if anyone wants to go to in your hospital, I think so many Bangladeshi people also already treated from your hospital. So, what is your experience?
Okay, I think the experience is great. Of course, when you talk about every patient, is different emotions play a role when it comes to cancer. So it's not easy. But I think with adequate care, adequate management, most of these patients can be treated very well. And this also applies to Bangladeshi patients.
Most of the times, cancer not properly diagnosis in the early stage.
Yeah.
So, diagnosis is the really important in the early stage.
Yes.
What is your
Okay, I mean, when you talk about cancer, we always advocate or we advise patients to go for screening, you know, especially when you talk about women, breast cancer screening, cervical cancers, and of course there are things like colonoscopies and all that when you're worried about having cancer per se. But I do agree, early screening is very important, early checkup is important, and early diagnosis. The earlier you diagnose cancer, the better the treatment can be delivered.
Thank you, Dr. Anil. Dr. Iskandar, quality and safety is the utmost important for the healthcare. Which types of quality and safety you provide from your hospital?
Actually, quality and safety is the most important part that IGN, utmost important for IGN. First, actually, we always being updated with the latest technology. If we don't have it, we will actually be trained for it. Okay, that's one. Number two is we make sure that actually we always have all the staff having the best education. We keep on updating our staff. And then, of course, the third one, we always being transparent. That's the most important part. We always be transparent with the patient for any complication or any complication that might have during the procedure itself. So, again, basically takes quality assurance very important.
Thank you, Dr. Iskandar. Dr. Arnil, cancer treatment is so many costly treatment. So, how many cost Bangladeshi people can face for getting the better treatment from your institute?
Okay, that's going to be a very difficult question to answer up front. With better technology, better treatment, of course, the cost is higher. So to give you a number, I think is very difficult. It's actually, you should talk to your doctors and see what the plan of outcome is. But I do feel that with newer treatments, I feel that my patients are surviving longer, they are living a better quality of life, unlike what was 10, 20 years down before this. So you need to come and talk to your doctor.
Thank you, Dr. Arnil. Dr. Azimuddin, we have mentioned the price issues and how you and or your institution balance between the affordability and high price.
Basically, price is, I agree that some treatment, the price is higher, but it's all have to cater to what the disease is. If you require, proper treatment, proper diagnosis, you have to discuss like what Dr. Anil mentioned, discuss the outcome, what the outcome the patient prefer, what are the things that they need. In order to treat the patient, definitely the cost is important also. It's not, but what we offer in KPJ is we always see how before we start any treatment, we have to see what is the aim of the treatment, okay? And is it really achievable or not? And based on what cost the patient has. So we will cater based on that. Okay.
Thank you, Dr. Azimuddin. Dr. Iskandar, innovation play a crucial role for the better treatment. Which types of innovation you have?
There's a lot of innovation that we have. As I mentioned earlier, one is about the ablation. It's one of the treatment of the arrhythmia or abnormal heart rhythm. That one we have. Actually, we are the highest number doing it in Southeast Asia. And then, of course, the minimally invasive cardiac surgery. Also, we are starting to do it, and we have success to do a few patients now. And IGN also a center for heart transplant. Heart transplant. Actually, it's the only center in Malaysia doing heart transplant currently in Malaysia. And not to forgetting that we also are very excel in doing a coronary angiogram for the blocked vessel. Now we have a lot of technology to open the blockage. We have a drill inside the vessel. We can drill it. We can give a shockwave balloon so that we can crack the calcium inside it so that we can put a stent, properly put a stent. So these are the kind of innovation that we have. And we keep on trying improving ourselves, and not only that, we also involve in the research, industry research, so that we actually can share to other people, sharing knowledge with other people what we have done in IJN.
Thank you, Dr. Iskandar. Dr. Arnil, would you share the success rate of your treatment?
Okay. Again, success rate depends on the type of cancer you're dealing with. The type of cancer and the stage of cancer.
Which types of cancer are you handling most of the time?
Okay, as an oncologist myself, I've been trained top to bottom, brain and all the way down. So what we see commonly in Malaysia, we see a lot of breast cancers, lung cancers, colon cancers.
In Malaysia or Asia Pacific, breast cancer is the common?
I would say in general, I think all over the world. Yeah, so it's a very common cancer that we need to deal with. So when you have common cancers, more research is done on common cancers, more new treatments are available. And of course, as a doctor myself, sometimes I hard time to keep up with it, but we have to learn as we go along. So that's something about oncology.
Dr. Iskandar, what is your success rate in your hospital?
The success is very high, actually 70 to 80%. Depends on what type of procedure what we're doing. But if you are talking about the ablation part, actually it can be up to 100% closely 100% because why the latest, because of the technology making
Latest technology is the essential part for success rate.
yes, because it make the procedure much more faster, the success rate become higher. That's why we are promoting the innovation in IGN.
Thank you, Dr. Iskandar. Dr. Azimuddin, innovation plays a crucial role. Obviously, it's play a crucial role. So, which types of innovation you have in your hospital?
What Dr. Iskandar mentioned, we are going towards minimally invasive surgery. So what this minimally invasive surgery that we can offer is, in terms of orthopedic surgery, is arthroscopic surgery. We do arthroscopic surgery for the knee. Now we're going towards endoscopic surgery for the spine. So we don't need to open up huge wound scar. So in terms of doing endoscopic, you can treat those with prolapsed disc endoscopically, in which the wound will be just a small tiny wound and patient can rehab faster. So minimally invasive surgery, we have it in our hospital in KBJ, from arthroscopy of the knee joints or ankle joints, and also for the spine.
So, have you handled any Bangladeshi patient?
Bangladesh patient, yes, I have few. Recently, last few days.
What is your experience?
Oh, it's okay. I mean, my experience after giving Bangladeshi people are very, they are well educated. They know what their problem. It's easy to tell them what are the things that we want to of surgery. What are the things that we can to do. They are basically they know what we want, what they want for the treatment.
Thank you, Dr. Azimuddin. Dr. Arnil, Bangladeshi people mostly speak out in Bangla, and in Malaysia they are maximum types of speak out English or in their own language. So, language is the barrier, do you think, in this treatment?
For me, barrier is not. Of course, I don't speak Bangladeshi, but I think we can get not I think, but we can get interpreters to come and help and assist. But I will find my way to discuss and all that. And I think a bit of English, and I think the Bangladeshis who are working in Malaysia right now, they can actually speak Bahasa, our own Bahasa Malaysia. So I see no problem. Thank
you. In your hospital, which patients come from in your hospital in Bangladesh or India, Singapore, Indonesia? Which country from?
The highest one is from Indonesia.
Indonesia.
Because why? Because the price is much more competitive compared to their own country, Indonesia. Recently, last week, actually, I've been asking a lot of patients why actually you come all the way to Malaysia, because you also have a lot of doctors there. But actually, for them to come, flight ticket to come to IJN, see the doctor with the treatment, and then hotel payment is almost the same by seeing a doctor there. So that's why we are offering a competitive price, and then with the same service, and we're hoping the service that we give actually better than the other place that giving. So that's why actually most of the patients are from Indonesia.
Okay, and Iskandar, thank you. Dr. Iskandar, thank you so much. Dr. Azimuddin, most of the Bangladeshi people choose in India or Singapore or Thailand. So Malaysia is maybe the new destination for treatment. So what is your appeal to the Bangladeshi people?
What I would say that in terms of competitive price, like what Dr. Iskandar mentioned, we can offer competitive price. Not that too expensive.
Price is the only issues for.
It's not the issue. Sometimes in terms of logistic, the traveling, in terms of public transport, where they want to stay in Malaysia, how it's convenient for them to move around, especially in Malaysia.
Because both are the Muslim nations.
Yeah, we also is mainly Muslim nation. You can, the mosque is all over the place. There's no issue in terms of going for prayers, eating halal food. It's very convenient for a Muslim patient to come and seek treatment in Malaysia. Shouldn't be any issue.
Thank you, Dr. Azimuddin. Dr. Arnil, maybe you have talked with so many Bangladeshi doctors, so maybe you have experience in Bangladeshi doctors, Bangladeshi hospital management. So what is your observation or reservation about the Bangladeshi healthcare system?
Okay, that's not an easy question to answer, but in my practice, I think it's all about getting the best treatment available, and I feel it's all about discussing. When I sit down with any patients of mine, my consults are quite long to go through everything, that is necessary. So I guess that would probably answer the question.
Thank you, Dr. Anil. And Dr. Iskandar, obviously in Malaysia there is a public institution or private institution. Which institution is better, public or private, or equal?
It's equal. Of course, it will be equal. But special about Malaysia is, regardless Dr. Azimuddin or Dr. Anil place, the government has set a ceiling price for any treatment that we give. We cannot go more than that. Okay, that's why our price is almost the same. This is controlled by the government.
Cost is same from all hospitals, public or private?
No, there's a ceiling.
Okay.
But usually IGN will go much more lower than that. Depends on how much profit they want to make. Okay, but because of that, I think it makes much more easier, cheaper. Even though government also offer a better, a good service. However, the technology mostly for cardiac care is in IJN compared to other place in the government institution in Malaysia.
Okay, thank you, Dr. Iskandar. And Dr. Ardil, if anyone wants to getting appointment from you or from your institution, so directly I or anyone can mail or getting appointment?
Okay, can. I think through MHTC is one way, but the Prince Court website, there is a link there. You search my name, link, there's a way to message through, and basically it would come to me. And of course, we can do online consults. Okay, from Bangladesh, we would like to do an online consult first to decide whether...
For that online consult, charge will be applied?
Yeah, there will be a charge applied, but at least you can get an understanding, and if the patient is comfortable, then I will say come over.
In that time, the language can be a barrier online?
I mean, there might be, I guess, but as I said earlier, we may need to have, I will have a translator, but I'm sure we can work out something. But the facility is available. You can contract through the website by emailing through the website, the Prince Court Medical Center website. And there is also somewhere where you can do an online consult. So I'm very open to that.
Okay, Dr. Anil, thank you. Dr. Azimuddin, if I want to, or seek your appointment, how I will knock you?
With the
or by MHTC?
Okay, with MHTC itself, the body can help. We have our KPJ in health.
Own platform.
Yes, we can always through that KPJ in Dhaka. Oh, now we have advanced in internet. We have our own website. You can always Google or search in the website in KPJ Ampang Puteri. There's a lot of appointment specialty in orthopedic. You can search inside the website, and you can always make an appointment.
Thank you, Dr. Azimuddin. Dr. Iskandar, same question to you. Only MHTC the only way to contact with you, or anyone can contact with you?
Anyone can contact, no problem. Actually, based on the website, just go to ign.com.my. From there, actually, you can choose any doctor with any specialty. We also do what did just now Dr. Anil say is telemedicine or teleconsultation. We also did that, so that actually patient can understand before they come what to expect, and then what the recovery, how long actually need to be the recovery process. Everything we can do that through the online platform. And then our website is very super efficient, because they will reply in fast, based on what the subspecialty that the patient needs.
Okay, as a doctor, would you recommend MHTC for getting appointment?
Of course, we recommend MSTC to make them much more easier, because I heard that MSTC not only giving the appointment to the doctor, but also how to fetch the patient from the airport, and then where to go, and then where the nearby hotels, nearby the hospital. So I think it will become more convenient for the patient to come here in IJN.
Thank you, Dr. Iskandar. We will conclude this show. Hope in near future we will talk again on these issues. দর্শক অনুষ্ঠান শেষ করছি, দেখা হবে আগামীতে অন্য কোনো বিষয় নিয়ে অন্য কোনো অতিথির সাথে। সে পর্যন্ত সবাই সুস্থ থাকুন, ভালো থাকুন।